Hammer toe, or in some instances referred to as claw toe, is a condition that develops due to abnormal forces in your toes. And this is a deformity that I'm sure you have seen before and potentially may even have had for some time. This is a deformity where the toe curls up and the middle knuckle of the toe becomes more prominent, and the toe can sometimes even tilt to one side or the other. We call this hammer toe or claw toe to describe that deformity that develops. And hammer toe or claw toe can cause problems in several ways. It can cause pressure at the tip of the toe because of the toe curling and then creating pressure at the tip. It can also cause pressure on the top of the toe because of the knuckle becoming more prominent as this deformity develops. Then you can get calluses, pressure pain, redness, sometimes even ulcers or open sores because of the pressure that it creates. In other cases, a claw toe or a hammer toe creates pressure on the ball of the foot because as that toe starts to deform, the joint that connects it to the foot can sometimes dislocate or separate itself from the foot. And as it does so, it pulls the pad away from the bottom of the foot and makes more pressure underneath. To kind of show a picture of this on the model, the best way to think about a claw toe is to imagine a straighter toe with a very gentle curve being a normal toe. A claw toe typically develops with the toe developing a buckle on the top. So if you look at it from the side, you can see it elevate like this, and then from the front also lifts up higher than the other toes. And it can deviate to one side or to the other side depending upon the deformity that develops in the way that this claw toe happens. This can happen from several reasons. It can happen because of genetics, where you may have been predisposed to this. If you have a bunion can also cause pressure on the toe, and that toe can stretch ligaments, making the toe deform. In addition, this can happen because of cramping from abnormal shoe wear or improper shoe wear, and then it can also happen because of injury that develops because of stretching of ligaments again in sports injuries, walking injuries, or just simply wear and tear happening on a daily basis. You know you have a claw toe or a hammer toe because of the deformity that you notice, and then also typically pain that's associated with it. From home, there are a few things that you can do to help to prevent or at least to take care of a claw toe and to reduce symptoms from it. The first thing to do is to look for shoes that don't cause pressure on the toe. And this may seem obvious, but sometimes it's difficult to find. And what you're looking for in a shoe that prevents pressure is a shoe that has a wider or deeper toe box so that pressure on the top of the foot doesn't occur, and also to allow more room for all of your toes generally. In addition, sometimes a stiffer sole to the shoe, or at least to the ball part of the shoe, can also reduce pain, and it can reduce stretching and stresses on those toes. If you use more of a cushioned insole in the shoe, then you have less pressure underneath, and that can help to improve some of those symptoms as well. There are several items on the market that can help you as well before you see your physician or your doctor for this. And some of those things can be toe straps that pull the toe down or hold it in place, toe spacers. There are even some straps that are designed to be able to hold all of your smaller toes in place as almost separate sleeves on a little bit of a pad underneath the foot. Many of these things can be very helpful. If you develop calluses, then callus products can help you, including callus pads and then also devices to help to remove some of those calluses that develop. Once all of these items have been tried, then it's appropriate for you to seek medical care if you feel like you're having continued pain, or if you're starting to notice that you're getting progressive ulcers or calluses or other signs potentially of pressure problems. When you see your doctor for a hammer toe or a claw toe, he will initially probably take x-rays of your foot and determine how much and how severe the deformity is and how much you would expect this to progress and create additional problems. And then he may also suggest some of the same things that we've talked about that you can choose for home remedies, including the straps and the pads and so forth. He may even have you do some taping of your toe to maintain its position for a period of time. These things all give some help, but cumulatively probably only have about a 30 to 40% chance at best of resolving symptoms from a hammer toe. When a hammer toe or claw toe becomes more significant, then it's appropriate for surgical treatment to take place. There are several ways that a hammer toe can be corrected. The most common way is to either remove or fuse the middle joint of the toe. When that middle joint is fused, then that toe remains a little stiffer but becomes balanced and doesn't tend to ride up or shift to the side like it did previously. And a fusion can occur through several ways. It can happen through just a flat cut of the bone, or a fusion can occur through some type of a device, a reaming device, for example, that helps to stabilize the toe. The foot mind reamers are the ones that I use in my practice and have been very helpful in maintaining stability for hammer toes. Another way that a hammer toe can be corrected includes the use of a tendon transfer from the bottom of the toe to the top of the toe to stabilize the toe. And this can only be done when the toe has remained flexible and hasn't become stuck in a position. There are different other additional procedural parts to helping a hammer toe, which can include tendon releases, other types of tendon transfers, and different types of ways of fixing the toe after surgery.